We've all felt it, haven't we? Just completely swamped by information, especially in fields like health policy where things move so fast.
Lily, it's a constant flood.
And the real challenge isn't just finding stuff, it's getting the right information accurately and crucially on time without just, drowning.
Yeah, timely and trustworthy. That's the combination.
So today we're going to try and cut through some of that noise. We're looking at something called rapid reviews. We're doing a deep dive into a really interesting paper by Haby and colleagues. The title's a bit of a mouthful. What are the best methodologies for rapid reviews of the research evidence for evidence-informed decision-making in health policy and practice? A rapid review.
Quite meta. Rapid review about rapid reviews.
Exactly. And our mission really is to figure out how these shortcuts to knowledge actually work. What do they involve? And, can we actually rely on them when big decisions are being made?
That's right. We're going to unpack the world of rapid reviews, look at why they exist, the different ways people do them, and what impact they actually have on health decisions.
Yeah.
Because there's this real tension, isn't there, between needing answers quickly and, doing rigorous science. Speed versus certainty.
Okay, so let's start with the why. The paper reminds us this isn't exactly a new problem.
Not at all.
Way back in 2005, the World Health Assembly was already talking about needing better ways to get knowledge into practice for public health.
Knowledge translation.
Exactly. Knowledge translation, which is basically, taking research, synthesizing it, sharing it, and making sure stakeholders actually use it to make health systems better. Closing that gap between knowing and doing.
The classic no-do gap.
Right. But even with that goal, the paper points out some big hurdles. Why don't policymakers always use research?
Well, access is part of it. Finding good quality stuff.
Sure, but the biggest thing reported, lack of timely research. You can imagine, right? A policymaker faces a sudden crisis. They need evidence now.
Yesterday, preferably.
They can't wait 2 years for a full systematic review. No way.
Precisely. And that's the conflict. Systematic reviews, they're the gold standard. We rely on them for guidelines, assessments, everything.
The best evidence synthesis we have.
Yeah. But they take time.
Yeah.
Often a lot of time. Months, sometimes years.
Which creates that no-do gap you mentioned. We might have the knowledge somewhere, but getting it to the decision maker quickly enough, that's the bottleneck.
So the big question becomes, how do you get solid, reliable evidence into the right hands fast enough to be useful?
Enter rapid reviews.
Exactly. They're offered up as the solution, or a solution. A whole range of different methods, really, all designed to produce evidence faster,
yeah.
while ideally keeping the quality and credibility high. The balancing act.
So, okay, rapid sounds great. But the paper points out a pretty immediate problem. There's no single agreed-upon definition for what a rapid review is.
Right. No standard definition, no single agreed methodology.
It seems a bit loose. People use different terms, too, like evidence summaries, rapid syntheses, brief reviews.
It's definitely a fluid concept, which can be good, adaptable maybe, but also confusing.
The paper does propose a working definition, though, which I found helpful. It calls it a type of systematic review in which components of the systematic review process are simplified, omitted, or made more efficient.
Okay, so modifying the standard process.
In order to produce information in a shorter period of time, preferably with minimal impact on quality. But here's a really key bit. Further, they involve a close relationship with the end user and are conducted with the needs of the decision maker in mind.
Ah, that end user focus. That feels critical. It's not just about speed for speed's sake.
Right, it's speed for a purpose, for a specific audience.
And that definition highlights the flexibility. Some people define rapid just by time frame, say 1 to 6 months.
Yeah, I saw it.
But others, like Abrami and colleagues, use the term brief review to emphasize it's not just about time. It can also be about narrowing the scope.
Scope? How so?
Well, you might ask a much narrower question. Or maybe you only look at studies from the last 5 years, or only studies done in, say, North America.
Oh, okay. Limiting the boundaries.
Exactly. Or maybe you do a less in-depth analysis. Just report the main findings. Don't dig into every single detail. It's about strategic choices to fit the need and the timeline.
So if rapid implies speed, but there's no single definition and no single method, how are they actually doing it? How do they achieve that speed?
Well, the paper shows it's quite varied. There isn't one standard set of shortcuts everyone uses.
Right. So what are some of those shortcuts? The paper lists quite a few ways they modify the systematic review process.
Yeah, there's several common ones, like you mentioned, focusing the question, narrowing the scope, that's a big one.
Okay, what else?
Searching fewer databases, maybe sticking to the main ones like PubMed or Embase instead of casting a super wide net.
Mm-hmm. Less searching time.
Or limiting the search to just English language articles. That's quite common.
Okay, that cuts down workload but could miss things, right?
Potentially, yes. Or excluding gray literature, things like unpublished reports, conference papers, dissertations.
Stuff that's harder to find anyway.
Exactly. Then there are shortcuts in the actual review process itself, like using only one person to screen titles and abstracts or to extract the data.
Instead of the usual two independent reviewers.
Right, which is faster, but increases the risk of errors or bias.
Makes sense.
They might also limit how many full-text articles they actually read closely, or skip hand-searching the reference lists of included studies.
Little time savers adding up.
And finally, maybe they do a less detailed assessment of the risk of bias in the included studies, or they provide a more minimal synthesis, fewer firm conclusions or recommendations.
Wow, okay, so it's quite a menu of options for speeding things up.
It really is. But this variety leads to a huge issue, the paper flags, transparency.
Ah, yeah, you mentioned that earlier.
Get this, one study found that about 43%, nearly half, of the rapid reviews they looked at didn't properly describe their methods.
43%, seriously.
Yeah. They didn't clearly say which shortcuts they took.
So as a user, you wouldn't even know how they got their answer.
Exactly. How can you judge the quality or the potential limitations if you don't know what steps were skipped or modified? Makes it really hard to trust the findings.
That really hits the core issue, doesn't it? The big million-dollar question. Do these shortcuts actually change the answer? Do they compromise the conclusions you'd get from a full systematic review? Could they lead policymakers down the wrong path?
It is the million-dollar question. And honestly, the research comparing them directly is, well, it's very limited.
Really? Not much hard data.
Frustratingly little. The systematic reviews included in the Haby paper, they basically concluded there's scant empirical evidence to definitively say, yes, these specific shortcuts introduce bias that changes the bottom line. Or no, they don't.
So we don't really know for sure.
We don't have strong, consistent evidence across the board. It's a major gap.
And the few case studies that exist seem contradictory.
They do. The paper mentions one comparison looking at things like drug-eluting stents. And in that case, they found the rapid reviews and the full systematic reviews essentially reached the same conclusions.
Okay, that sounds encouraging.
But then there was another comparison, this one about using potato peels for burns. Bit of an unusual topic.
Ah.
And there, the results and conclusions were different between the rapid and the full review.
Oh, so sometimes they match, sometimes they don't.
Exactly. And complicating it further, in the potato peel case, the rapid review authors actually argued the systematic review missed some relevant trials.
Wow. So it's not just about speed, it's also about the underlying quality of any review.
Precisely. That's the crucial takeaway here. It's not necessarily a simple rapid versus full debate. It's really about high quality versus low quality. A really well-done, transparent rapid review, one that scores highly on quality assessment tools like Amstar, is probably going to give you a more reliable answer than a sloppy, poorly conducted full systematic review.
So we should be assessing quality using the same standards, regardless of the type of review.
That seems to be the implication. Don't just assume rapid means lower quality or full means high quality. Judge each review on its own methodological merits.
Okay. So despite the uncertainties about methods and comparisons, the paper did highlight something quite positive, didn't it? Something about the users.
Yes, this was a fascinating finding. It involved a specific study, an RCT by Opio and colleagues, that looked at how different ways of presenting evidence affected decision-makers' understanding.
An actual randomized trial on evidence formats. Cool.
Yeah, and they compared different summary formats. One of them, called PAC-C, was basically a short, locally relevant narrative report. Pretty much what we're calling a rapid review.
And what did they find?
Well, interestingly, there was no difference in whether decision-makers got the actual clinical questions right based on the format. But PAC-C, the rapid review format, scored significantly higher for clarity and accessibility. Decision-makers found it much easier to understand the information about the quality of the evidence.
So even if the ultimate answer wasn't different, the understanding and usability were better with the shorter narrative format.
Exactly. They preferred it. It was clearer, easier to grasp, which ties back beautifully to that definition we discussed.
About the close relationship with the end user.
Precisely. It suggests that rapid reviews, when done well and tailored to the audience, can actually improve how decision-makers engage with complex evidence. It's not just faster, it's potentially more useful.
That's a really important point. So let's bring this down to brass tacks. For the people actually using these reviews, policymakers, clinicians, program managers, what's the practical advice?
The paper gives some clear guidance here. For the users,
Yeah.
they should actively ask for two things: an N-star rating or some other quality appraisal score.
To gauge the methodology.
Right, and a clear statement of which shortcuts were taken.
Yeah.
Demand that transparency.
Okay. And for the people producing rapid reviews?
The big message is, be transparent. Make your methods crystal clear in the report. Maybe use templates or checklists. Even put the nitty-gritty details in an appendix if the main report needs to be short.
Got it. Full disclosure.
And when choosing which shortcuts to use, prioritize the ones less likely to mess with the quality or introduce bias.
Like limiting the scope.
Exactly. Limiting scope, maybe focusing data extraction on just the key outcomes, restricting study types included those are generally seen as lower risk modifications.
Okay.
But whatever shortcuts are taken, producers absolutely need to explain the potential implications to the person requesting the review. No surprises.
Makes sense. Communicate the trade-offs.
And finally, on an organizational level, having skilled staff who understand decision-maker needs and can work efficiently is key. Streamlining internal processes helps too.
So it sounds like the goal isn't one single perfect method, but rather making sure each individual review is transparent enough to be judged fairly.
I think that's exactly it. Transparency allows for trust. It allows the user to understand the strengths and limitations.
So what's next? Where does the research need to go? If we want to make rapid reviews even better, what questions still need answers?
Well, the big one is what we discussed earlier. We desperately need more empirical research on the actual impact of specific shortcuts.
Those direct comparisons.
Yes. Prospective studies comparing rapid and full reviews on the same topic, done rigorously, controlling for quality.
Oh.
We need to build that evidence base.
What else?
Developing specific reporting guidelines for rapid reviews would be huge. Building on things like Prisma for systematic reviews, but tailored for the unique aspects of rapid reviews, like that user relationship.
Like a Prisma R or something.
Potentially, yeah. And future studies need to look beyond just, did the answer change?
Right.
We need to measure things like the quality of the review itself, how satisfied users are, whether the findings actually get implemented, and even cost effectiveness.
Right, the real-world impact.
And perhaps most importantly, does using rapid reviews actually lead to greater use of research evidence and policy? That's the ultimate test, isn't it? Are they fulfilling their primary purpose?
So wrapping this up then, rapid reviews. They're clearly here to stay, an important tool trying to bridge that gap between research and real-world decisions.
Definitely emerging. Definitely important. They offer a way to get relevant evidence faster, which is critical in so many situations.
And even with the caveats, the lack of a standard definition, the limited data on shortcuts, the key takeaway seems to be
That there's no reason to dismiss them out of hand. There's no evidence saying these shouldn't be done or that they're fundamentally misleading.
Right.
And in fact, as that PO study showed, they can actually make evidence clearer and more accessible for the people who need to use it. That's a significant benefit.
So a final thought perhaps for you listening. As you encounter evidence, maybe in your work or just staying informed, think about how it got to you. Was it distilled? How? Was it presented clearly? A really effective rapid review isn't just about being quick. It's about being transparent, focused on the user's needs, and ultimately empowering action. So maybe ask yourself, what steps can you take to make sure the evidence you rely on is both timely and truly trustworthy?